Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today is World Mosquito Day, and Stephanie Desmon is joined by Dr. Michael Adekunle Charles, CEO of the RBM Partnership to End Malaria. They discuss why the fight against mosquitoes carrying the malaria parasite is stalling and how a WHO endorsement of a new class of preventive tools could be such an important new weapon against the disease. Let's listen. Michael Adekunle Charles, thanks so much for joining me.
Thank you so much, Stephanie, for having me. Great to be here.
So you are the Chief Executive Officer of the RBM Partnership to End Malaria. For those of us who are not familiar, could you tell us a little about that organization?
Yes, thank you very much. The RBM Partnership to End Malaria is a global partnership bringing together almost 500 partners in endemic countries. We have academia, we have research institutions, we have the donors, we have the civil society organizations, and really just working together under the umbrella of RBM in terms of ensuring that we can continue to advocate, we can continue to raise the resources, raise the awareness, but more importantly, have a coordinated approach around malaria elimination.
So let's talk about malaria elimination. I know that have been a lot of gains over the last several decades, but things are slowing down. So I'm wondering if you could talk to me a little bit about what the malaria situation is right now on the ground.
Correct. So there was a lot of progress between the year 2000 and 2015. The cases of malaria came down significantly. However, since 2015, we've seen stagnation, and in some cases we've actually seen an upsurge. And this is mainly due to 4 main reasons. The first one is the mosquito is so smart that it continues to evolve. So there's mutation, and because of that mutation, there is what we call drug resistance and insecticide resistance. So the usual vector control methods that we have, such as bed nets, insecticide-treated bed nets, we see that the mosquito, instead of dying on the bed nets, they're now dancing on the bed nets because of resistance. The second issue is really the climatic variation, the adverse weather patterns. We know the breeding site for mosquitoes are stagnant water. So if there's increased water, increased rainfall, then that's a perfect breeding site for mosquitoes, and we actually see the increase. We're able to see a 5-fold increase in 2022 in Pakistan alone due to the Pakistan floods. The third main reason is, issues around conflict. When there is conflict, then people are displaced. They don't, have their nets to sleep under. They don't have the usual vector control measures, and then that increases. And then, one of the other reasons is actually funding. The amount of funding that we had earlier on in this century, 2000 to 2015, it has gradually gone down and down and down. And we know that, for all these tools that we use, we need funding. We need money to get the tools to the right places. So that's also contributed to the increase. If I can just give some statistics, in 2023, we had 263 million cases of malaria globally, and we had close to 600,000 deaths of malaria. Now, if I break it down in terms of what does that mean? That means about 1,600 malaria deaths every day. If I break that down even further, think of jumbo jet, an Airbus, 300 passengers. That is about 5 Airbuses crashing every day. Mainly children under the age of 5 and mainly on the African continent. If we do get jumbo jets that crashes, it makes big news. We're seeing 5 crashes every day due to malaria. That's significant.
Hmm. Those are staggering statistics, frankly. So, the World Health Organization has just recommended, for the first time in decades, a new category of prevention tools to go along with the insecticide treated bed nets and indoor residual spraying, which means spraying some pesticides inside the home. Tell us about this development and why it's important.
We welcome this development with open arms. As you rightly said, this spatial repellent was recommended by WHO just recently on the 13th of August. And this is again another tool within our toolbox. We know the mosquito behaves not usual the way it usually behaves. So in the past, mosquitoes would bite mainly indoors at night. We're now seeing that mosquitoes are biting earlier on, maybe in the afternoon or in the evening, and there are even some outdoor, biting mosquitoes. So this repellent is actually a fantastic tool because it repels the mosquito, it disorientates the mosquito, and it also kills the mosquito. So when people are not yet under the bed net, the repellent works fantastically because then it repels it from biting humans, which will then prevent malaria. It's also good because it's not yet resistant against this repellent. So once it comes into contact, then the mosquito will die off. So this is really, really a great initiative, a great innovation that we welcome with open arms. Maybe just one thing is that WHO recommends that these repellents are used together with existing tools. So bed nets, as you rightly said, indoor residual spraying, we have to use it all together to ensure we get the maximum benefit.
So, can you describe this repellent to me? I've seen pictures, but if you could describe it, that would be great.
So the repellent is you put it on the wall. So it's easy to just put on the wall in the home. You just need basically a nail. You hang it there. It diffuses some chemicals called transflutrine. And that transflutrine then will be able to either repel, disorient, or kill the mosquito. The good thing about this is that it's ease of using, number one. But number two, you can just also hang it on the wall. Anybody can do that. And it can last up to 1 year. And this has nothing to do with, behavioral patterns of human beings. Once it's there, it's there. You can forget about it and be rest assured that it will do its work. So we're very, very excited about this, and we welcome such innovations moving forward as well.
And it's sort of like a thin film, essentially, that goes on the wall. Yeah.
Correct, yes.
And I wanted to go back to the point you just made about how this is a complementary tool. So my understanding is that some folks who were testing it just thought, oh, great, I don't need my net anymore. So talk to me a little bit about why the net is still a very important tool.
The net is important because with the repellents, we're hoping to capture most of the mosquitoes. But obviously, as I said, mosquitoes are very smart. So we still need to continue to protect ourselves, protect our babies, protect the children under 5 to get the maximum benefit of it. It's the same thing with when we say vaccines. We know vaccines is also a new tool in the toolbox, but we're also saying vaccines alone will not do it. We need to use it in combination. And I think that's the beauty of all these innovations is that let's continue to use the existing tools as we then adopt these new tools to get the maximum benefit.
So is it a costly intervention?
I'm not exactly sure of the cost at the moment because it's quite new and we need to, take it to the market and really roll it out. The more it's rolled out, then the cheaper the cost becomes. So I think time will tell in terms of the cost, but the beauty is that it's easy, anybody can use it, and it protects everybody in the household, not just children under 5, but every single person.
How would I guess there's this new announcement that WHO is in favor of using these, but how does it get into people's houses?
And that's the beauty of the partnership within the RBM partners, because obviously we have the donors, we have the endemic countries, we have the researchers, academia, civil society organization. So what we're now doing, once WHO has recommended it, then countries will need to adapt it, start buying, start making sure that they are used. So civil society organizations are very important to be able to support that educational part in the communities. Obviously, government's commitment is also quite important in this to be able to get it to the right places. So again, it's a beauty of the partnership where we can work with every single stakeholder to ensure that the product gets to the place as quickly as possible.
And I guess just having this isn't going to be enough, right? We have to help people understand what it is and why they should use it.
Correct. And that's why we say community engagement. We need the civil society organizations who are closest to the communities to, first of all, understand it, to accept it, to be able to access it, and really to ensure that it's used or put to proper use. So, the beauty of bringing everybody together, the various stakeholders, is really my day job in terms of really just advocating, ensuring that, such tools are really rolled out as quickly as possible. There's no point in WHO recommending a tool and then it stays in the shops or on the shelves. We need to get them out as quickly as possible to ensure that we get maximum benefit.
Well, I know you mentioned funding, and I've got, the U.S. government funding cuts on my mind. Will that stand in the way of something like this being implemented quickly?
Well, with innovation, obviously, with new products, we need funding to be able to distribute it. We are hoping and we are working with various governments to ensure that, funding towards malaria is sustained. We're working with the endemic countries as well to ensure domestic resource mobilization. So definitely we do need funding. The funding we have is not enough for the existing tools, not to talk about another one. And so we will continue to advocate. We thank the US government for all the support they've given over the years, and we remain optimistic that more support will be channeled towards malaria and towards the people and the countries that need it the most.
So it feels to me a little bit like the mosquitoes are winning. What do we expect going forward?
Good question. What do we expect going forward? First and foremost is that we need to get ahead of it. And how do we do that? We need innovation. We need research, number one. Number two, we need to ensure that the tools that are in existence are put to good use. So again, community engagement, making sure that we can mobilize as much as possible. The third thing is we need resource optimization. We know the resources are dwindling. How do we ensure then that with the limited resources, we're actually going even further? And that's why we say, universal health coverage, primary healthcare systems, making sure that we work together as a community, not just the malaria world, but working with the HIV world, with the TB world, as a health holistically, we need to work on. And then finally, tackling malaria cannot be seen from a health perspective alone. It has to be a multisectorial approach, what I call a whole of society, a whole of government approach. If we see, mosquito and the fight against malaria, it is really agriculture is there. Because with swampy waters, breeding sites for mosquitoes, so infrastructure, development, gender, climate change, you name it, there's a link to malaria. And that's why we say for us to be able to defeat, and if we look at countries that have defeated malaria, we've seen that they've used a multisectorial approach. Everybody has to be involved in it. And if everybody is involved in it, then we will be able to make greater strides. So for me, that's clearly the future. Use innovation, use all our experience, and really making sure that we have a whole of society approach in the fight against malaria.
Michael Adekunle Charles, thanks so much for joining me.
Thank you so much, Stephanie. This has been wonderful.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu. for future podcast episodes. Thank you for listening.